did have one new meat manager that was his first week that he had been transferred to that location. So we are retraining and doing everything that we have with all the individuals, and have an action plan to make sure that we rectify that this doesn't ever pop up again. And that's our goal, and we've been working at it every day. Chris has been at the store with us retraining the staff. Tom was just talking about our evening manager, Emily. She was our assistant customer service manager, and 2 weeks ago, or 3 weeks ago, our evening manager was moved to a different location, and she was promoted. So we are in the process of training her, and she will be food certified, certified, so to make sure that she understands proper procedures. And she was a little inexperienced, and we knew that, but we have been working with her, and obviously we didn't need to do a better job with that.
So a question that I had for you, I happened to drive by there today, and I guess I want to back up a little bit. I'm assuming, I don't want to put words in management's mouth, but I'm assuming because of transition, this was an oversight, because Tom has been there not long ago and these conditions weren't there. But I know what I was going to ask you too, to follow up with, I drove by there today, and that loading dock is still loaded to the brim. I mean, is that a pickup issue?
Yeah, so we were waiting on Tomra to pick up the plastic containers.
Okay.
So that's a location that we keep plastic in. We have two different vendors that we pick up our plastic and we pick up our glass. So they picked up our glass. And if you saw the two roll tops that we have back there, we've already filled up one or two, getting rid of the old debris and the rest of the stuff off that dock area. So that's currently what we are doing.
Okay.
In the past, the practice was they were keeping it in bins, and they hadn't supplied us. With COVID, they haven't. Tomra used to pick up, who's the one who picks up our plastic, and then we have another organization that picks up our glass. They used to do it twice a week, but of lately it's been a little bit more difficult. It's more like once every 2 weeks. So we don't have enough bins sometimes. So those carriages that were back there are damaged carriages that we don't use. So at the time that he did come to the visit, yes, that those were in carriages, and I can understand where you could see that old plastic bottle, dirty bottles in a shopping cart, that's going to be used for shopping. Then that would be unsanitary.
Right.
I haven't not met Tom. I met Mark. Mark met me about 2 weeks ago, 2.5 weeks ago, when he followed up on the visit to make sure for maximum occupancy in the building.
All right, and then you did say, I just want to circle back. So you did say I think you said it was assistant manager would be certified as a certified food manager.
She will be doing the trade. So she's what she is an evening manager. So
Okay.
she just took the position. Before, she was assistant customer service manager, and now she's taken. We posted for the position. She's taken the position of the evening manager. Jay Corover is our assistant store director, and he obviously is food certified. I believe Tom may have. Jay had told me that he had worked with Tom before.
Question.
Yep,
Yes, sir.
Do you have a certified manager all the time when they have the store open?
Yes.
And they're all well trained?
Depending on the evening, so that's where they might have an allergen. There's a difference between the allergen training and the food certification training.
And you also have your cleaning crew completely working there. Nobody has been fired, and the staff has not been reduced.
No,
Okay.
you mean no one?
How do you explain
done in the training?
How do you explain these accumulated complaint violations rather than a instantaneous one? Because some of these things should have been like this for a couple of days at least, or a week. So how do you explain these things?
What question are you asking?
Some of the pictures I saw.
The buildup of residue.
Whatever, it doesn't happen on a single day if the cleaning crew and everybody is working as they're supposed to.
Yeah,
but how do you explain this if you have all the cleaning crew working there? How do you explain this?
Those were the
Is
Yeah,
it
those
negligence
were,
from any supervisors or negligence on the part of the workers, or what do you have?
it would be negligent on the department of the individual department heads. The individual department heads are responsible for cleaning those departments. We have logs in each individual. We have a store log that we do for the entire department and the individual departments for logs on when they're supposed to clean and disinfect every 4 hours.
Mhm.
And then in certain areas they clean every 2 hours. And then we have a store logs that we do since COVID began. And obviously, you're right. The neglect buildup from especially in the deli la carte, the different thing. It's poor management, and it's our responsibility to rectify and make sure that doesn't happen.
Is there somebody who looks at all these logs and makes sure things are done properly? Is there somebody there, or
Yeah,
they have-
every day they're collected, brought to our attention to make sure that they're checked off. But obviously, that wasn't checked up on the cleaning inside the departments.
so that the process will be changed so that things get monitored and as well as cleaned?
Yeah,
up
so we're
properly?
creating. Like I said, I'm going to have somebody that does it multiple times a day.
Well, I understand. If once they have the log needs to be verified so that things are going
Right.
up through, because you can may have the log and nothing entered and nobody sees it, then
Right.
log is no good anyway. So at that time.
Exactly. Anyone can fill out a log, but the point is to make sure that not necessarily that the log is checked off, every, whether it be the 2-hour log, the 4-hour log, it's that it's actually being done.
Yeah.
And that is what I have been projected or held accountable to do, and to make sure who's ever running the store, whether it be me, whether it be Jay, the assistant store director, or whether it be Emily, the eating manager, to make sure that that's rectified. We've already cleaned and done everything, except for the back hallway. We're still waiting for the bottle pickups, and then we have some other equipment that we have to dispose of inside those bins, and then everything will be done and rectified for a follow-up visit. Yeah,
you should also have an entry to check the ceilings, because last time that we suggested it, when you had an issue, September 2018, we had brought you back here into the board.
Okay.
And there was a damage on the ceiling, and then I think it was some kind of a refrigeration line that was creating problem.
Right.
And
yeah, we replaced.
Everybody looks down on the ground. Nobody looks at the ceiling. So that was suggested there that they should look at it and put it on the log. So you need to make sure that it's implemented.
Yeah, I know we changed, I think, about 8 ceiling tiles. So we had somebody from a company called Veritech who we've assigned, who every 30 days is kind of going to come in and do preventative maintenance. We'll actually be checking on those ceiling tiles so they can log them and know, all right, this spot 30 days ago it wasn't. So therefore we can go up and start looking at refrigeration lines. We have contacted our refrigeration company. They'll be in over the next 2 days. We had a couple other issues that they needed to rectify. One was a case that was down at the time of the visit. No product was in it, but they were going to monitor that and then make sure. And then if in turn we need to get a roofer to make sure there's not a leak in the roof, or whether or not it's a refrigeration line, which will be held under the Hussman company.
So this is going to be implemented now on, is that right?
It just started today. The guy came in today, and every 30 days, this company will come in and handle maintenance calls and check those instances for us. Something we just enacted today.
Yeah, strict compliance is very important here, because you're a large store and you cater to a lot of local residents and outsiders. So there is a huge population at risk. So we need to make sure that you have better handling on these compliance issues.
Okay.
I'm done. Thank you.
Before I go to the other board members, Chris, did you want to add anything? I know you jumped back to.
Yeah, I apologize. I had some technical difficulties with the storm, but I just want to kind of reiterate some of the points, especially things that myself and other senior managers are doing for the company to kind of alleviate some of these issues and really monitor them and prevent them from occurring moving forward. So I myself and the department specialists have actually basically put aside time over the next 4 weeks to visit the store myself at least 2 to 3 times a week. and the specialist at least once a week to really, once again, monitor and validate the cleaning procedures are actually taking place and that the checklists aren't being filled out. Kind of like mini food safety audits each time we go in to make sure we're maintaining the standards. And as Ryan said, we do have an outside company, third party, really coming in for that monthly preventative maintenance. So, as we identify the issues, we're not going to put it off for that 30 days. We're still going to put in work orders and submit the work orders accordingly. So that way we can act on it a little bit faster. But if we do miss anything or have small projects, those are when the preventative maintenance is really going to occur. And then I know the training was brought up of the new evening manager and the department heads. So I myself am actually going to be hosting a training both Thursday and Friday at the store for all of its department associates and the managers, whether they be new or tenured managers. So that way we can go over the exact standards that we're looking for the cleaning process, cover all the cleaning materials and the chemicals that we use. And really that way they can't say they didn't know the standard or the procedures that they need to follow really to prevent this from happening again. Because obviously this isn't our standard as a company, and this isn't the standard obviously we want anyone to associate our name or the Shaw's name with. So we're definitely, it has brought to the highest attention of VP of operations. And I mean, everyone is fully aware and on board to make this one of our better stores, just based off the visit we had last week.
Thank you for that. Judy, go ahead.
1 second.
Judy,
You go fala.
I'm going to mute him again. Judy, you're muted. There
Sorry.
you go. That's okay.
I guess what I'm concerned about is what we're seeing with people coming before the board for the last 3 or 4 weeks, is that these issues that come to light don't seem to have taken place over a week or two, possibly a whole lot more than that. So I guess I want to know, you put managers in the store, and I'm glad we have a new manager, and it's going to get straightened out. But what do you do now currently that maybe you weren't doing with corporate coming in and checking your stores? Because I'm kind of blown away that there were these issues there, especially during the pandemic. I know we've heard several complaints that you haven't had people at the doors checking and counting the number of people. I know I was at a competitor's in another town, actually in Bourne today, and there were so many people in the store that I left. So I don't know if you've improved that as well, but I just feel like, come on guys, this is really important. This is a pandemic, and you're charged with, you might be the only place most people go out, and they hope to be safe there. They're really counting on us to keep them safe and to keep an overview of everything. And I just don't even know how this happened.
If I can answer that, I agree with you. I can't. I was just in Northbridge for 1.5 years. I've been in Clinton. I've been with Shaw's for 25 years. I've managed over 12 in my career, 15 locations. And if I were to say, all right, there were some issues there, and I'm there to fix them.
Okay.
And I we'll fix them. And in hindsight, it should have been done quicker. I think the stores had multiple managers in Tom's absence, because it wasn't for sure if Tom would come back. He came back once and came back. And the lack of maybe in a single leader caused those inefficiencies. We have since changed a few department heads, and this is the ultimate, I guess, kick in the ass that they shouldn't have ever come to this.
Yeah.
But now that it is, it will be adhered to, and it will be. You're absolutely right. In Northbridge, we have established procedures and protocols. And do we have a bad day here and there? Yes, but what you saw pictures of is not a bad day. That's a bad week, a bad month, and it's totally uncalled for, and I myself felt embarrassed, and that I haven't been able to change it quick enough, and I've never sat in front of a board of health meeting before in my life, so
Well, hopefully you don't have to ever again.
exactly. And I know it's extremely serious, and I take it serious. And I can tell you that I will do everything that I can. And
Thank you.
with my 25 years of experience, we'll make sure that that will not happen. And that's not to say that we're going to be perfect, but damn sure we're going to be better than what you guys
Thank
saw.
you very much. I look forward to seeing that.
And if I can just add to that, I know with the pandemic and a lot of uncertainty in the areas, we do have established protocols. However, over the past couple of weeks with, the phases of Massachusetts reopening, unfortunately, we have gotten a little too lax with everything that we've done. So we're actually relaunching all of our COVID protocols because we have seen a change in our stores and the monitoring and everything like that kind of decline. Once again, with the reopening and the phases of Massachusetts. So we are relaunching our programs and protocols. So hopefully it's going to tighten everything back up. So we're going to go back to the standards that, at the very beginning, Ashland's knew that Shaw's had. Because we've had several visits of COVID compliance that have all gone very well. So once again, we're going to tighten everything back up, relaunch those programs, and we're going to be, as Ryan said, as close to perfect as humanly possible moving forward.
Tom, did you want to add something?
Yeah, just revisiting the issue with certified staff. I know that you had mentioned Emily was going to get certified. So in the evening hours, does one of those certified managers train department leads in food safety protocols and principles? Because I feel like at night there was kind of like a lack of oversight in the individual departments. Do those department managers themselves have certified food protection certificates? I know that's normally the case in other grocery stores that I deal with. So is there any plans to kind of ramp up training with closing staff to make sure, I know you mentioned checklists, but just to make sure that these things are going into action and that there's active managerial control? I think it's wonderful Emily's going to get the certificate, but if she's spending most of her time kind of canvassing the store and in the front end, I don't think she'll have that direct oversight in the prepared foods, the deli, and et cetera. So could you just elaborate on that?
So most of our department managers actually do have the food safety certification. It's actually a conversation we had in one of our district meetings last week about scattering some of the management oversight. So that way there is at least one food safety certified manager in the building at all times for that particular reason, to have that oversight of all the other departments to make sure everything is, in order. So that is a conversation the district manager had with all the stores last week. So that is definitely something we're working towards, to kind of change the scheduling to have at least one certified manager in the store at all times.
May I suggest that maybe you should look into the certificate managers per square foot area, because each of these establishments have large areas compared to any small restaurants where one or two will be sufficient. Maybe you may want to enhance the people with more certifications available, so that instead of one person looking at the entire floor area to manage it, may not be able to do it in time. So if you have 2 or 3 available at any one given time, that may be helpful, so that they can distribute the load of observing, monitoring, and then straightening out things where they are wrong.
Absolutely, because we do have assistant department managers as well. So maybe that's something we can look into, to have them trained as well.
Chris, do you have any questions?
Yeah, I want to first acknowledge to Ryan and to Chris that I wouldn't want their job. It's a hard job to manage a supermarket. I understand the complexities of that kind of organization. And I think both have been very sincere and genuine about their intent and have owned up to the situation at hand. And I'm glad, because it's really necessary to us as a board and to the constituency in which we serve. But I also think that because there have been some past offenses with this particular building, and they may be different, but it's still the same store in the same place. I think that we owe it to the people that we serve to make sure that they know that we're not being lax, and that the people that we oversee in the same businesses don't think that, okay, this kind of thing happens, they just go there and they give you a little slap on the wrist and yell at you and it's no big deal. I think it's important that we emphasize, and I think that both Chris and Ryan recognize that this is a very serious thing. But I would also recommend that if any of these offenses are finable according to our programs, that fines are imposed accordingly, so that so that all involved understand that these are serious policies and rules. And as far as continued inspections, if we need to increase our inspection program for that particular store to make sure that they're following their protocols and doing as they say, I think that that's necessary as well. So, but I also want to say thank you very much to Ryan and to Chris for coming here and for not trying to skate past the issue, and for acknowledging the real problem, and for having a plan of action moving forward.
Ron, go ahead.
Yeah, this is more of a question for Tom. I also, echo at least what Chris had said. I appreciate Ryan and Chris and your candor and coming in front of the board, and I know you're going to get things rectified. But Tom, you do this all the time. Is there, and I don't, you have enough crap to do. I know I'm not expecting you to hold their hand, but are there protocols, or do you follow them step by step to make sure things are getting done? Or do they just know what needs to be done and it's up to them? Or can you give them any resources, whether it's checklists, whether it's, this is how it's done in other stores, to make sure that their practices are such that they're going to meet the standards that are set by the law and that you expect?
Yeah, that's a good question, Ron. Thank you. And then I think Chris can allude to this. Between myself, Ed, and Agent Orem, since the beginning of this, we've provided the grocery store orders in writing to the store management, the checklist for retail and grocery establishments that Chris is also familiar with. So we definitely try to, and at least I try to, provide the operators with all the pertinent information that they need. And also, too, what you also brought up is give them examples of how other people in the field might be doing something, or what their approach is. I know we've had a couple of issues. I've been in this store many times since the beginning of the year. I make that a priority to go into the grocery stores, because I feel like they're the highest risk in the community. And alluding to what, referring to what KG said earlier, they serve a larger population. So Chris, Mr. Doyle is very well versed in what the requirements are. It's just a matter of there was a disconnect, I guess, and those things getting executed this time around. And I'm glad that, and having worked in the grocery industry myself for 15 years, I can certainly understand and empathize and relate with how hard these people work and how much really they're putting themselves at risk on a daily basis during these times. So it's really important to follow what the protocols are. And then, believe me, it's a learning curve for everybody. Sometimes we've seen earlier on in the pandemic how these requirements and things coming down from the governor can change, by the week. So it's hard to keep up with what the requirements actually are. But I think that moving forward, I have confidence that, Shaw's is kind of well aware of what they should be doing, and they're going to take steps to implement that.
Okay.
Well, I do want to kind of conclude this. We do have another establishment that we want to talk about. But I do want to, I know we've all said it, but because of both grocery stores, because we have both of your management here, that, it is such a large volume of people that people are not leaving their house these days, and the only place that they're going is a grocery store or maybe a local food establishment to get takeout. So, I mean, the volume of people that we're targeting, we're all trying to protect, is very large right now. And I think I was not on the board at the time, but to know that this is the second physical appearance at a Board of Health meeting was a little shocking, I think, to some of the members, including myself. So I do believe we have your attention. And I appreciate it. I know, time is valuable, so I appreciate you coming to a nighttime meeting to discuss it. And please keep up the good work, and hopefully we won't see you on a Zoom meeting in the future. KG, did you have something to add?
Yeah, I do have a question for Tom. Under normal circumstances, that is prior to COVID issues, are these establishments on a 2 per year inspection list, or are they multiple? Tom?
So yes, Katie, sorry, I had a problem with the mute button.
No.
So there's 2 permits in the Shaw's, one being for the sushi and one being for the supermarket itself. At a minimum, I try to get into these stores 3 times a year. However, I can say with confidence, over the past 3 years, I've been in the store several times. We get a lot of, because of the volume of people that are served, we get a lot of complaints that initiate inspections, and some of them are frivolous and unfounded, and others are found with cause. So I find myself in this establishment quite frequently, and I make it a point, even if I didn't get a complaint, to inspect the supermarkets in the community on a frequent basis, and treat it as an urgent category risk, and that would mean a minimum of 3 inspections per year.
Okay, if need to be done more, it's better because they keep the community safe from any issues that come up between inspections. So that'll be helpful.
I agree, KG. Thank you.
Thank you, Diane.
Chris, do you want, you mentioned the fining and the inspection. Do you want to make a motion, or do you want to leave it be? I mean, I guess we can throw it out there for discussion for the board. I know Tom, what did we have? Sorry, I'm shuffling pieces. This is what happens when you do this for home. Shuffling pieces of paper. What did we have for critical, Tom?
We can't hear you, Diane.
Diane, we can't hear you.
I'm sorry.
We're losing your voice.
We couldn't hear you.
When you turn your head, yeah. When you
turn your head, we couldn't hear you.
So Tom, what do we have for, I'm just thinking if Chris was to make a motion to issue a violation notice to Shaw's, what do we have for critical violations? Kind of going backwards here. Nothing critical, right?
Let me pull up the report and I'll count them.
Okay, I'm just looking at it here. We're in the process of changing systems too, so it'd be nice when we can. Just looking here, I don't see, I mean, we have,
I know, Diane, if I may, the executive order through the governor speaks about a $300 fine for repeat violations associated with COVID.
okay.
So seeing as though as I was in there, I think a couple of times, I'll have to look at my reports, but I believe I was in there for a COVID-related complaint in June about people not counting the customers entering the store.
Right.
And then this time around was also a COVID complaint. So I would suggest or recommend to the board that they issue a $300 fine.
Okay.
I have a technical question. Can we, so I don't know where this $300 goes. Does it go into additional, so we can inspect more often places? Or is it something we can say, a $300 donation to Ashland Food Pantry?
So the town adopted a fining schedule many years ago. It's called non-criminal disposition. So when a violation notice is issued to an establishment, we have a tiered approach. What Tom is referring to is a governor's fee schedule versus ours that we have adopted locally. By law, that money has to go into the general fund if it's issued under non-criminal disposition. I kind of to back up a little bit, I mean, we brought you here and the next establishment because we take this very serious and we want to set the tone out there that we take these things very seriously. The last establishment did not get a violation notice because of they were getting penalties to the state instead of to the town. I don't have an issue with them getting a COVID violation.
Hi, this is an exclusive announcement.
Jeez.
Well, just so you know, I apologize. I walked away from it because I heard a loud bang, and I wanted to make sure my house was okay. Crazy. So what's the board members feel about the $300 COVID violation fine?
Yeah, I move that we fine Shaw's $300 for a repeat COVID violation, and they should be subject to additional inspections at our inspector's discretion. And
At their expense.
I believe I believe they pay for those inspections, if I'm not mistaken,
Correct.
and impose paid inspections at the inspector's discretion.
Can I get a second? Maybe not. Okay. Any further discussion?
I mean, in principle, I agree with Chris. I don't think that a store of that magnitude, a $300 fine, does anything. I think it does to a mom and pop pizza place. And I do think that that extra inspections at the store's expense would be reasonable. And I don't disagree with Chris. I just don't really know what kind of motivation that is.
I'll tell you, Ron, if I can answer that question. Yeah. You're right. To a company like Shaw's that may be big enough to absorb the $300, it's not that big a hit.
Yeah.
But it does two other things. First, it imposes fairness upon the smaller people who it is a big hit to, that we are going to fine in the same circumstance. And it also shows everybody, regardless of their size, that there is a fine structure for a very specific reason, and it shouldn't be ignored. That's my position on it.
And if I can add with what you're saying is because we need, I mean, especially with COVID, again, I'm referring to the last one as well. These places should be spick and span. They're supposed to be having extra cleaning. They're supposed to have extra checks. They're supposed to have extra staff. There shouldn't have been this situation, period, if they were doing what they were supposed to do for COVID.
I'd also add, if I can, that the people that voted for us to be their Board of Health, to be the overseer of them, to protect them, in this particular case, if there is a COVID violation that they should be fined for and they're not being fined for, I don't think that's going to sit well with the constituency. And for no reason other than we're here to serve them, I as a constituent, I'd be angry under the same circumstances. It's not meant as much to be, like you said, it's a slap on the wrist to the corporation of Shaw's, but it's also significant and symbolic of the fact that they made a mistake, and mistakes come with consequences.
You convinced me. I'm going to second that motion.
Yeah. Okay, let me just further discussion. Tom, did you have something you wanted to say?
Yeah, I just wanted to say that, I mean, technically, if you wanted to, you could issue the COVID fine, which is linked to the governor's executive order. And I think it references the same CMR that the town bylaw does, under the ability for the Board of Health to issue fines under the state sanitary code in the form of a nuisance notice. And then on top of that, you could theoretically go through the inspection report and reference the town bylaw and assess a fine for each critical issue on top of the $300. But we'd have to look at the report and tabulate that.
So I was holding back only because, the last one we didn't, because there was also a state thing involved, and I'm just trying to be fair across the board. But listening to Tom and the additional fines that could take place, and knowing that we've gone in there before and things weren't fixed, and I don't know. It's Chris, right? Dan,
Chris Doyle.
Doyle. You said something about you've been a little lackadaisical, not that word exactly, but, pulling back a little on the COVID stuff. And I think it's probably quite the opposite you should be doing. So I'd like to bring it up for a vote again.
Okay, yep, so we do have a second. Any further discussion? Okay, all,
I think it is justified in terms of, because we need to make sure
Okay,
they
great.
learn a lesson and then continue to keep this store safe enough for people to visit back. But these are the only stores that people get in there to get their groceries, and then the source needs to be clean and safe.
This is our first and hopefully our last COVID fine, so.
Hope so.
So I'd like to call for a vote. All in favor?
KGI.
Hi,
Judy,
Chris.
Hi, Ron.
Aye, Diane. All in favor. So Tom will issue you a violation notice for the COVID, and keep up the good work, guys, and hopefully things get better. Or things will get
I
better.
guess,
I'll also
I guess Tom will also do follow-up inspections.
I was just going to say that I'll be there for a follow-up inspection Wednesday evening.
okay.
Is that Wednesday, tomorrow evening?
Yes, tomorrow evening.
Okay.
Right. Thank you.
All right, guys, you're more than welcome to stay in the meeting, but we're gonna move on to the next establishment.
Okay.
Tom, you all set for King BB?
Yes. So Sergeant Berman conducted a COVID compliance check. When was that, Ed, for King BB's?
July 28th.
July 28th.
July 28th. I went out there the next day because of some concerns that Sergeant Berman had brought to my attention, and conducted a full sanitary inspection. And upon my arrival, the certified manager wasn't there. And then I was told by the staff on site that he's rarely there. He actually works at the other store that is in, I think it's in Malden, I'm not sure. There was 2 broken refrigerators. So my assessment was they didn't have enough refrigeration to support the menu that they're presenting to the public. I saw some poor hand washing practices. I saw a gentleman rinse his hands off haphazardly in a food prep sink rather than wash his hands in the designated hand sink as is required. And then the designated hand sink itself was obstructed, I believe, with bottles of soda. I did submit to the some photographs from this inspection as well.
Yeah, you couldn't even get to the sink.
They were also keeping some raw shell eggs in a broken refrigerator that temped out at well over 70 degrees. And just so for the board's knowledge, whole shell eggs are supposed to be held at 45 degrees or below. Every other hazardous food is supposed to be held at 41 degrees or below. But eggs, you kind of have that little bit of a buffer, but to be at 70 degrees is really a risk to public health. So I made them throw it away on site. There was
If I could just interrupt you just one second. I just know here in Ashland, Chris just lost power. He's rebooting. He's getting back on. So if anybody has interruptions, we'll just do the best we can.
Okay.
Thank you. Sorry.
No problem. Also, no date marking of some prepared pasta in one of the working refrigerators. And then the poor washing, rinsing, and sanitizing practices for utensils and equipment. The 3-compartment sink was not set up properly with hot soapy water, rinse water, and sanitizing solution. Also, many of the things that Sergeant Berman had reviewed with them weren't being implemented. The COVID practices, obviously hand washing is pinnacle to all of this. Signage and more of a sanitizer availability for customers and staff. So just overall concerning findings. I then issued them a 72-hour notice of correction, and I told them that they would probably be requested to appear. But then I did go back there on the 30th, and some of the issues, but not all, were corrected. We still have the issue with nobody has an allergen certificate that's there. Nobody has a serve safe certificate that is there full time. We still have 2 broken refrigerators. They've agreed to reduce their menu until they can get those repaired. But I just feel like it's just kind of a deer in the headlight situation. Nobody really has any command over what's going on there. I feel like there's a lack of what we call active managerial control and executing food safety practices that are expected and are always the case. And then also on top of that, the COVID concerns that we will require heightened cleaning practices during these times. We always require cleaning practices by a version of the food code. We want equipment to be sanitized properly. We don't want people just rinsing things off in the sink. We just want these are common practices. These are expected things that we want to happen, and just overall unacceptable findings at this inspection.
Okay. Is it Julio? Are you Julio? Okay. Julie, do you want to address some of the concerns with the board for us, please?
So I'm not Julio. I'm his son. So
I'm sorry. What is your name?
My name is John.
John.
Yep. So as like what he was talking about the refrigerator. So I just called him and then I just talked to him. And I told him.
John, if I can interrupt you for a minute, are you a manager there? Do you own the business? What do you do?
No. I'm the son of Julio.
Oh, okay. So you're the son of the owner?
Yeah.
Okay.
So
and if I can just ask you, just for my knowledge, are you a certified food manager? Are you?
Mm-hmm.
Okay.
So I just talked to him and I just on the phone and I told him about the refrigerators. So they got broke, I think on 25th. And then I told him, I'm gonna get another 2. I'm gonna get 2 new ones on Tuesday next week. And about the hand soap, those things you already got fixed.
If somebody else has anything to say, I'm actually speechless because I guess I'll start off by saying that Tom has already mentioned it, that I mean your establishments should be cleaner than it ever has been because of COVID. So for him to walk in and find these violations, it's not too often that I am speechless, to be honest with you. My fellow board members are going to be surprised. Please, if somebody else has anything else to say. Go ahead, Tom.
I just want to mention I'm sorry, what's your name, sir?
John.
John.
John, I noticed when you logged on earlier, just by happenstance, that you were in the kitchen. Was that the kitchen of King Beebe's?
No, that was Malden.
Oh, you were in Malden. Okay.
Yeah, I'm in Malden right now.
Because I noticed there was quite a few folks that didn't have face masks on, just as a point of reference. So these are the type of issues that we don't want to happen. I know that's so I won't even get into it because it's a totally different restaurant. But so you're in Malden. Who's at King Beebe's right now? Who's running King Beebe's? Is there a adequate certified manager there that is on staff there?
The owner. But he didn't speak English, so I'm gonna just translate for him. I already tell him about the things in Ashland.
Okay. Who are you translating for?
For my dad, Julio.
Is that who is standing behind you?
Yeah. No, yeah, he's the owner.
Okay. So as we speak in Ashland, so neither one of you are in Ashland. Who is in Ashland right now?
Quem que tá em Ashland agora? Quem tá em Ashland é o meu gerente e o cozinheiro. The manager and the chat and the chef.
Okay, what do we have?
The person who cooks and then the manager.
Okay, so what's the manager's name? Where I'm at right now, sitting here, is I'm not confident anybody is paying attention to what's going on at this establishment. So you can translate that to your father, but I'm feeling very unsettled about the situation we have in front of us right now.
Okay, so you want to know the name of the manager, right?
Yes, who is running the store as we speak?
Quem que tá lá? His name is Narcelio.
That's a first name?
Yes, and I don't know his last name.
Okay, does your dad know his last name?
Sabe o último nome dele?
Silva.
Silva.
And is he a certified food manager?
Ele é o cara que cuida da comida, assim? Yeah.
Okay, where is that person's certificate?
Que é? Cadê o negócio do certificado?
Então, não, ele vai fazer o certificado. A gente já tá vendo uma companhia para fazer o certificado para ele.
So he gonna do the certificate, and we are looking for the company. You are already looking for the company.
So just so you know, I needed a receipt yesterday for this.
And I also have a concern, and again, I think I know where I'm going already with the situation, but this inspection was done on the 28th. You went back on the 29th, you've been in contact with them, and now they're telling us that they're getting a refrigerator a week from, so that's, maybe look at my calendar, because I don't want to be incorrect, 11th.
Okay, so I told him that I bought the refrigerator, and I cannot go pick up them. They're gonna deliver it for me, so I cannot like go to the store and pick the refrigerator. They're gonna deliver it at the restaurant. I told him that on the phone, and he asked for a receipt. Você mandou recibo do refrigerator?
Fala que a gente já providenciou, já tá tudo funcionando lá.
Já tá tudo funcionando? Já. And the refrigerator, the owner, he said, the refrigerator, they already fixed it. They already put the new one right there.
I didn't understand that. I'm sorry, what was that?
The owner, he said, the refrigerator, it is running right now. It is running. It's not broken anymore.
Okay.
Did they repair it, you mean?
What?
It's been repaired?
Yeah, it's working right now.
Okay, so did he hire a repair company to come in and repair it? How did it all of a sudden start working?
Quando é que começou a funcionar?
Na sexta-feira, o rapaz do Bonadio foi lá e já viu que estava tudo arrumado. Fala assim, se tem algumas coisas para a gente fazer lá, a gente vai fazer. Só que devido à pandemia, a situação de nós que somos pequenos é muito mais difícil que os que são grandes que já estão quebrando. Explica para ele. Fala que a sexta-feira o Bonadio foi lá e viu que estava tudo ok. Que o que a gente pode fazer, nós fizemos.
Ele falou já que foi lá sexta-feira.
Por enquanto, o que nós podemos fazer é só contratar uma companhia para dar o service safety.
So what he told me right now, the Board of Health just go there on Friday. He sees some things that was wrong. We know about that. We are gonna fix it. But like about the pandemic, so the things go like go low for us, like money, those things. And the only thing there now they're looking for it is like a company to do like the certificate, the service certificate.
So do you have anybody on staff in Ashland that works there full time that has the proper certification?
Tem? Alguém que trabalha lá o tempo todo que tem esse negócio de certificado aí?
Eu fico lá 4 vezes por semana.
Ele já falou que você não fica, Marcelo.
Não,
você raramente vai lá. Não adianta mentir.
Fala para ela que não, que é o Narcelio que vai fazer o curso.
Is it Narcelio who going to do that?
Eu preciso de
Narcelio, the manager. He's going to do that.
He's going to do that. He doesn't have that though.
Right.
Yeah, he doesn't have that.
Eu preciso de 2
All right.
semanas.
John, just hang on tight for me for 1 minute. Tom, can you help me out here? Because I don't think my recommendation to the board is probably going to be too welcomed.
If you're going where I'm going, we're in the same place, I think.
Okay. I was going to say, I didn't know.
I'm for it.
So John,
Yep.
I guess got to jump in. I completely understand money's low. COVID has really hurt a lot of people. And I know small businesses have really, really been affected. And my heart breaks for that. But it doesn't lessen the fact that during these times, especially, we have to be so careful about health and safety. So those refrigerators aren't working. And you don't have anybody there right now that's food certified. So I don't know how you're open, because the refrigerator has to work right for you to serve good food that's prepared and and stored correctly. So I'm kind of worried, and I think this is what you're going to hear from the board in a minute.
Okay, so and the owner, who he said he need 2 weeks for Marcelo to get like the certificate, because he's
As of right now, John, had you have a receipt that you can email us? I just got something from, okay. So do you have a receipt that you have actually signed up for a class for Narcelio?
Ela falou assim, se você tem um recibo que você já colocou o Narcelo na classe, você pode mandar para mim.
Não, eu preciso que eles me enviem uma lista das pessoas que eles podem me indicar.
So he said he don't have a receipt. He needs you guys send him like someone who can like teach him or something like that, like to
Alguma
get the
companhia que seja
certificate.
conveniada
Like
com eles.
And let Tom speak.
Yeah. John, just hold on one second. Tom, go ahead.
I just emailed you, sir, a list of food safety instructors. If you go through it, you will find some of them teach the class in Portuguese. I highly suggest you contact one of them and get a receipt to this board as soon as you can.
Ele falou assim que já te mandou já por e-mail.
Quando?
When did you send it?
He just sent it. He just sent it because I just got it as well.
Oh, he just sent it right now?
Tom, so
Now,
I'm sure
looking at it, Diane, looking at it, they don't seem to have even minimum requirement that is needed to open a business like this.
Yeah.
So we need to keep the safety of the public
Let's get
in big consideration.
Let's get to the motion.
well, I was just going to say to Tom, I think you probably know where we're going. I don't think any of us five, I'm sure yourself, feel comfortable at all with this establishment being open today, tonight. There is nobody there who's certified. I could just reiterate my concern that just for the record, I'm muting them. So they said that somebody was there Friday. So it was a week ago that this was found out, and they have not even signed up for a class. That shows to me total disregard for the inspectors that have done their job. So Chris, if you'd like to draft a motion, that would be fabulous.
I move that we effective immediately, King BB's is closed for business until they can meet all of the necessary requirements to be open under the laws of the town, until there's a certified food inspector available during their opening hours, and until all violations have been cleared up, and until including the refrigeration and all other cited violations.
All food code.
Furthermore, I believe that they should be fined to the maximum possible the maximum possible allowed by our current food code and or COVID regulations for all outstanding offenses.
I second that.
I can't vote to find them any further in this climate.
I was going to say, I just want to say, so for further discussion,
You can move to amend.
Well, I was going to say, just for discussion, I'm anticipating that they're not going to be closed just overnight. I'm assuming it's going to be multiple days.
So can I amend it?
Sure.
That they be closed until there is a food certified manager there, and that could be John going to that location, until their refrigeration works properly, whether that means it gets delivered or fixed, and any other, Tom, are there any other major things that needed to be done? But I mean, I want them all done, but
what if we put all
I would
food
just
code
stipulate if they can't reopen until Tom Curran inspects them and makes sure that they're in compliance.
Okay.
I'll second that.
Yeah.
Okay, any further discussion?
Could you unmute John in case he has any questions?
Yeah, I was gonna just take the vote first, and then we'll make sure that he knows what just happened. So all in favor? Diane,
Aye,
aye.
Chris.
AG.
Judy, aye.
So John, there you go. I muted you. The board was having a discussion. I don't know if you followed it. Because of the nature of the violations, we have just ordered an emergency closure, excuse me, that's tough. An emergency closure of your establishment tonight. You and your dad need to contact the Ashland store and notify them that the board just closed your establishment because they do not have the proper certification, food handling, cleanliness of the establishment to be operating in Ashland. And until you meet all of the requirements and have an inspection from our food inspector, Tom Curran, you will not be allowed to open up your doors and serve food.
All right.
You will, actually, we didn't do the fine, okay. So, how do we, I mean, I'm sure, I know how we're gonna ensure that they're not open here. But is that, Tom, I assume you'll just go, well, we can talk about it after. So John, you'll notify the Ashland establishment that they need to close the doors?
Yep.
Okay, and if you need assistance, you need to reach out to Tom and he will work with you to get certification and get everything up to par.
Right.
All right.
Okay.
Thank you.
Okay.
All right, you're welcome to stay on our meeting, but you don't have to.
Thank you.
Thank you.
Tom, just to finish up with you, I just wanted to check. I didn't know how you wanted to handle it tonight. I mean, I'd be willing if, and somebody else wants to do it as well, but I'd be willing to go there and make sure that their establishment is closed. I'm just not confident at much right now, so.
If somebody could just verify that they did close tonight for me, I'll be out there tomorrow night. I will certainly go by there. I think the board made a wise decision. It's unfortunate. However, I don't see any real effort to kind of bring the business clients.
I'll go over. I'll go over as soon as we're done.
Thank you, Ed.
Yeah, I'll go over, Ed. We can go over together just because.
I'll pick you up.
Oh,
I'll pick
great.
you up.
Look at that.
Hey,
and,
police
I
escort.
Can I just make a comment, everybody, about this? You know, I just want to just reiterate what a team this has become with, especially with Tom and I. You know, I go out and do a COVID and, you know, sometimes I'll just see other things. I pick up the phone, call Tom, and, you know, this is how we're finding this stuff. And also, you know, I sat with this company for almost 45 minutes going through all the paperwork, what they needed to do with COVID, and Tom shows up the next day and they didn't do any of it.
It's showing, and being involved with the town for many years, I mean, I haven't sat here and done this twice in the last month. We need to let these places know, and I think we're making it very clear that this is not how we operate in the town of Ashland. We want to hold these establishments to the highest standard, and if they're not going to follow the rules, they're not going to operate. I thought it was a blatant disregard, and I'm thankful that we all voted to do what we did. So,
Judy sees my phone number and cringes.
So what we'll do is
what happened?
Tom, I do want to let you go. If I can, I just want to talk about a couple of things while you're here.
I do have something for Tom, so.
Okay, did you want to go now, KJ? Go ahead.
I can. I'm sure, Tom, I think I had crisscrossed a text message or an email regarding emails to the food vendors about certified food manager being there. Has that been sent out already to all the vendors, or is that still on hold?
I will do that tomorrow.
Okay, because I was really concerned about certified managers being fired by all of these during the COVID situation, because that's one of the high-paid job, and they just eliminate that to save money.
Right,
So, and then the establishments come back here and then don't hire them, and then they conduct all these violations. That's what happens. So we need to make sure that they're aware that we're looking for the certified managers being there and the establishment is clean enough for that purpose.
I have a question. You know, we just learned, I don't know if we just learned tonight, but we certainly learned, some of us learned tonight, that they clearly have an establishment. I think it was in Mendon that they said they were in.
Malden.
So, you know, we closed their store in Ashland for gross violations. Do we have a moral obligation to call the Board of Health in Malden and say, you know, you might want to take a look?
Obviously, they shouldn't even have the cell phone in the kitchen.
Yeah.
It's one of the first violations that we already saw.
Well,
That's a good point, Chris.
I don't think it's a bad idea for us to do that. What I was going to propose is that one of us do it and not have Tom do it.
Yeah,
that's fine, and as long as it doesn't violate any state law or the federal law, that's
Right.
we are trying to keep the other
It's
population and the other side healthy.
It's public information that we just, this meeting's public information. I mean,
Sure.
there's no reason, and just for the record too, even the last establishment we had on here, I contacted the business owner who as well has a business in another community to make sure he knew that his investment here in Ashland was closed. So I have no problem doing it, and I'll do it. I'll contact Malden and let them know. Just and if we'll have to find out the name of the establishment. But
it looks like it's King BB's. I'm looking at Grubhub. King BB's Delivery, 298 Lebanon Street in Malden.
all right, I will take care of that for you. Just jumping ahead just a little bit here for the food update. I know, Tom, these are just, I listed a bunch of things on the agenda tonight or items that were kind of on my pending list, and I wanted to just review them. So the food program, I did see an email today that for the new program itself, there's going to be another training coming up. And then after that, it seems like that we'll be rolling that program out. Trying to think, is there any updates you want to give us on that food program, Tom? Or is it you'll wait or?
Just nothing really new, but just I'm anticipating the second virtual training with it. And then I think Mark had mentioned before he went on vacation, like a rollout in early September.
Yeah, but my thought on that is that I know we talked about looking at a grading system, but I think what we should start out doing is just rolling the program out, because I know it's going to be more user-friendly than you and Mark are both using the same system. And as we move into the program, I know with the COVID inspections have done that way as well, then we can talk about a grading system or things like that. Maybe we can talk about it, maybe in 4 weeks. I'm sorry?
Do it in phases.
Well, right, because I think the big benefit, first of all, is that you and Mark are both going to use the same program. That's big, so we can track everything. So let's get the program going, and then we'll talk about doing a rollout of the grading system, I'll call it, if that's okay.
Tom, I had a question regarding in and out timings at the establishment for inspection. Is that already in it, or have you talked to them to get that implemented in it?
It is KG. It is in there. And once you open the inspection, and then once you close it out and get a signature, that is also in there.
Timestamps kick in.
It also has a geographical coordinate on the report, so you could look it up to make sure that when I said I was at Shaw's, I was at Shaw's. So, but it also doesn't take into account like a post-inspection conference where because I have the report signed, it doesn't take into account also, I might spend another 45 minutes there, going over, walking through again, just to make sure that they understand what the violations are.
Find out how that can be incorporated in it, and if there is a way to do that too. They can add it for discussion or post-inspection.
Okay.
So that may be a way to keep track of it. That way, that your time is counted for.
Mm-hmm.
And Ed, does it also do the COVID inspection in and out times also on that one too, or no?
No, on the COVID, the software that we're using for the COVID does not time it. We could manually put it in, but in the notes, but it does not.
So you should probably incorporate that one in your report too.
Why?
It gives when it was in, how long did it take sometime to inspect it, because sometimes a small establishment may not take that long, but the larger one, it takes more time. So then we know that how much time has been spent in educating these establishments. and we can come back next time. So we spent so much time, we didn't learn anything. So we can
And
come back.
in general, KG,
Really not measuring that, KG. I think that you go in, you do the if they're going in and doing the education or, going around pointing. I mean, I don't see clocking in when you walk in the building.
No, not clocking them, but the amount of time that we're spending with these establishments, because we need to do that. That way, what happens if we need more help in terms of physical additional members, we can establish and improve it to the town, saying that, look, we need additional people to help us out. How do you count it?
Yeah, to that, Judy, I think to what KG just said, I'll second that too. We had talked about that in the past as well too, is at one time we were sitting in the basement trying to fight with management to say, we need more food inspectors. And they're saying, well, how much time do you spend in these places? So having that information is just data that can help us to say how much time food inspectors actually spend at these establishments. So that should we need an additional.
And that's a good segue to when I put these items on the agenda, I thought it would be healthy for us to go over some of the things which I call are on my pending list, which I'm sure is the board's pending list as well. But, But with the food program is that, I'm happy that we're all going to be, with the crew is going to be using the same program, but also like you said, we need that information. But like when Mark mentioned at the last meeting, and I'm sure everybody saw my face about bringing on another food inspector, that was before we talked to Tom. I talked to Tom, and Tom is willing, able, and capable of doing more hours for us. So at this point, I don't want to entertain bringing on any dog, but I don't want to entertain bringing on any.
It is, right.
I mean, obviously we don't have the data to establish it. I can't just convince and go and tell them to give me more money because I have no data. I need to have data. That's important.
Right. It's in general, it's less about more people than spending more hours and paying for more hours. Because even if Tom is doing it, which is great, we have to pay him for his time.
Definitely.
Tom's able to do more for us, so we've already had that conversation, and
that's terrific.
So.
Thank you, Tom.
If nobody has anything else for Tom, we'll let Tom go.
Okay. Bye, Tom.
Yeah.
Thank you. Tom, thank you very much.
Tom, thank you for your work.
Spend time with that baby of yours.
That's where I'm going now.
Two babies.
Twins, yeah.
Sorry.
Have a good night.
Yeah.
Good night.
That's okay.
Ed, you're up.
I'm up. Yay. So you can probably figure it out. I'm earning my nickname. I've heard I have a new nickname around town, especially because I've been visiting the baseball fields and making sure they're in compliance. I have a nickname now, the COVID Cop.
I like
that. Anyway, just so everyone knows, obviously you see I'm out there doing these COVID inspections, trying to do at least 2 or 3 a week if I can. The phone does not stop ringing. Our numbers are going up. So just so you know, since a week ago Monday, we've gotten 6 new confirmed cases and 9 probables. So that's a pretty significant jump from the previous weeks. But we're consistent with the towns around us, the numbers going up also. I think we see it, and you've all been driving around. We're seeing parties, backyard parties, multiple people, no one with masks on, really close together. Today, I don't know if any of you saw it, the governor announced that if these numbers continue to tick up, he's actually talking about bringing us down a phase, kicking it back, coming out of phase 3, going back to phase 2. Again, more to be seen on that. The other thing I do want to let you know that I've been working on, I know we talked about trying to plan for the future, especially if a vaccine comes out. What's that going to look like? To vaccinate, potentially a few thousand people. Even working with Framingham. So one of the things that I actually had a great conversation last week with Sam Wong from Framingham Board of Health. Any flu clinic or immunization or vaccine for COVID is going to look completely different than any other regular flu clinic because people are going to have to social distance. It can't be just where people show up. And also, if we do a clinic in the wintertime, even if we try to do a drive-through clinic, you can't have all this staff standing out in the freezing cold trying to do this. So one of the things that and I think I've mentioned this to the board before, I've been looking for softwares where people will be able to answer all of the questions on a questionnaire ahead of time. They say allergies, put in their doctor, their name, their address, and answer a series of questions, and then be able to book an appointment. That way we'd have a flow. People will have a great way to document it. So I looked at a few different softwares around, and yes, some were good, some were bad. And then my brain just kind of went crazy, and I actually figured it out how to do it ourselves. So I came up with it on Google Forms, and I actually was able to get an add-on added on to my Google Forms because the town has the enterprise license. And I was able to add on a calendar function where people can pick a date and time. And then, you can have, let's say you have 3 people at 8 o'clock on a Friday. Once those 3 people are signed up, that time slot actually goes away. So I actually finished that this morning, and I sent it to Sam Wong to test out and just give me some suggestions back and forth. What I'll do tomorrow morning for the board, I'll email you out what I've come up with, and you can try it yourself. I have it just set up as a test. And I've actually also used Google Translate to put the form in multiple languages.
Ed, can
yes.
I jump in for 1 second?
Sure.
Will it meet all the privacy requirements that are needed?
Yes. Yep.
Okay.
Yep. I've already checked it because it's going to be on the town secure site.
Okay.
Yep. Again, just looking for some feedback. Just trying to think outside the box. I did go over to the MRC trailer today also to see what we actually had for supplies in there. There's quite a bit in there, boxes of gloves. I did, since they were expired, I opened up a couple of boxes to make sure that the gloves weren't brittle or anything. They seemed fine. There's some masks in there. There's tables. I do think we need to look at ordering more stuff shortly. I don't know where that money comes from, just to make sure that we do have enough in the event we have to have multiple clinics coming up in the future, especially where PPE equipment is taking, up to 120 days to receive it once it's ordered.
Will you be working with Mark when he gets back on that? Because we do have, CARES Act money, but I know that we have grant money as we got 2 grants for COVID. The town has the CARES Act money, and then of course is Medical Reserve Corps money. So like you said,
Yep.
And we should have an inventory also of what do we, all right, we need a,
we actually do. We need a full inventory of that trailer, every last box, not just that there's 5 tables. We need to have a physical count. What I can do is I can check with Jen in the morning. What I maybe could do is get a couple of the high school kids that need community service. And
let's just check with Mark when he gets back to make sure, because I don't know if Mike Gurnick might have it. I'm still waiting to have an MRC meeting, but it's a great idea to have something like that, especially like you said before the weather,
Absolutely.
Yeah, you also need to check out what's expired there, so to take those and replenish them soon.
Exactly.
Right.
And that was another thing that I did have a talk with Sam Wong about. He actually said, to me that yes, they have enough supplies they think for right now, but he said whatever we could potentially order, they're going to be doing the same thing also, just to make sure we always have enough supplies on hand. That's my quick COVID update. I'll be glad to answer any. Like I said, I'm just trying. Every week is just crazy.
I also heard that there is a pop-up tent for tests that is coming up on August 5th in Framingham.
Yeah.
So it kind of to segue into my next agenda item about the City of Framingham Nursing Services. When I was on the conference call with them last week, which was very educational, they had explained that the demographics in Framingham, there's a certain concentrated area that they're noticing the volume of cases is higher. And they said that they were trying to get Spilker to open up a free clinic because those people could not get to the free clinic in Marlboro. And he said the demographics in this area, there's more than one family living in a home. So when one gets positive, it straight stems from there. So originally I was going to ask the board to write a letter or, to support that for Framingham, but turned out they got it anyhow, which they, reached out to them. They're thrilled because they're hoping that they can get a little bit more control of their numbers by having the free clinic. So kudos to Framingham for pushing the envelope.
Are there such areas in our town too, or no?
No, I'm sorry. No, we're spread out. There's no clusters at all that I've been able to identify.
Yeah. Ed, I know there's some of this you're interested in. If you want to, does anybody have any COVID questions for Ed? I just wanted to move on.
Yeah.
I know,
Any update on the water view large and other things? One of those?
Yeah. So again, they've had they did some random testing last week. They did have 3 of their patients retest positive, but they're still asymptomatic. And remember, and I just want to remind everybody that you can test positive up to 3 months, even by nasal swab. So as long as they're asymptomatic, they still consider them clear at that point. And again, I just kudos to Dutch and the staff there. They have been in constant communication with us.
He went down 2%.
And I just want to make sure, we've really fixed that communication problem with Waterview Lodge. They've been right on top of everything.
as well as Mill Pond, they continually send emails as well, which is very good.
Absolutely.
Just one thing to think about, Ed. I'm not sure of exactly, the manpower that's on this as far as scheduling things. So I think if just to gain a little bit more control, depending upon how many people are going to be coming in to make it more efficient, a few people going online and then seeing a slot go away, and then you might have 2 hours, at least at Newton Wellesley and, basically the partners network. I wanted to get one to just go visit my folks. So I found out they've been doing it now for 4 or 5 months, and it was a very well-oiled machine. You actually ask for the order is placed, and I know we're not talking about an order because you're not going to need one for this vaccine. Then the doctor places the order, then the testing center gets in touch with you and says, all right, come at this time. And they have 3 or 4 tents set up, and definitely 2 tents that people can go into. You drive up, somebody checks you in, they put you in a spot. There's probably 20 spots there, and it's just a steady line of people. It never seems like there's that many people. They just do it. I know that may take more administrative work to do, and it may not be possible, but that's kind of how they keep it, moving effectively.
Yeah. And I think we were just trying to figure out a way for people to be able to pre-register with all of their information instead of having people show up, try to fill out a form, and go from there. We kind of thinking of this as a pre-registration to be able to capture all the information that we need ahead of time.
That also reduces the contact time frame at that place. Yes.
Yeah. Again, we have to look at weather. I don't know. Again, just trying to.
Oh yeah. So
every time I think of something, 8 more things come up.
Well, we do have to be careful. I mean, and when we were talking, when we had the City of Framingham meeting last week, they said that the cluster that they were referring to, that's where they're having the biggest increase, and it does border our community. So of course that was a red flag, of course. So hopefully, with having the free clinic in Framingham for the next couple of weeks, that will hopefully alleviate that problem.
Can I just, I just want to, I want everyone just to kind of, because I was thinking of this too. Think about, when they open up these free clinics or the drive-throughs, the lines can be 2-3 hours long. I want to avoid that when a vaccine comes out. I want people to have a time to come in. That's what I'm trying to avoid, these lines of cars. And like just so you know, in Marlboro, the average wait time was 3.5 hours
Wow.
in your car. So
Yeah.
that's what I'm trying to avoid when a vaccine comes out.
Right.
Thank God you're thinking there ahead of time.
Yeah.
And
We appreciate
And
that.
they do in Marlboro also, they require you're required to have a phone. Everybody that's getting tested has to have a phone, and they text you when you know, from place to place.
good.
So talking about vaccinations and all that, again, I put some of these items on the agenda because they're kind of pending and I wanted to review them with the board. But I know we talked in the past about so the whole reason why we wanted to get into the intermunicipal agreement with the city of Framingham is because we were contacted them. They contacted us, excuse me, saying that they had a volume of people from Ashland that were coming there and they couldn't keep allowing residents to come there because we didn't have an agreement. So we asked Framingham for the numbers because I'm kind of curious how many people that they've done. And I chuckle a little bit inside because 2020, you can't really look at those numbers that well. But when I looked at the 2019 numbers, there's 80 flu vaccinations. Now I know Ron and Mark had commented they estimated about 300 Ashland residents. There was 80. Excuse me, I'm sorry, backing up a little bit. Sorry about that. I'm looking at too many numbers. So I'm sorry, there was 80 flu in 2019 and there was 56 in 2018. So the numbers are up there. But we were also advised that the reason why we needed more nursing services was because we have school-age children who are under or uninsured who need vaccinations. So when the information was sent over, I took it and I scrambled it again. We all like this data thing. I took the information, I tried to make some sense out of it, and then I gave it to Laura, who did a good job to finalize it. And just to let the board know the numbers, and again, I know they are 2020 is probably not that accurate, but in 2020, I went from age 17 and down. I assume 17 would probably be the cutoff. So they've done 5 children under the age of 17 in 2020. They did 25 in 2019, and they did 14 in 2018.
Not as many as we would like to believe.
I mean, the numbers speak volumes, and I just wanted to share that because it's not that I don't think it's necessary, but it's good to see the numbers on paper of how many people that they're going to be servicing for us.
AG feels so good right now about the importance of data.
I know.
I do, and I just, and I do have this. I've marked it up. I will get it to you. I don't know. I think Laura might have sent the spreadsheet to you.
She did.
It's very interesting. So I just wanted to pass that along. And again, that is good data. That is good data.
They could have gotten these things long time back if they wanted to show us all the data, but we didn't have it.
Well, the thing is, I think what was more concerning to me, to be honest with you, KG, is that we were told there was I'll say a lot. That's going to be my terminology. A lot of school-age kids that needed vaccinations, and to have 25, that's a good number. That's not a lot in my.
No.
I mean, it's good though. It's good. We made sure we got those 25 children vaccinated. And with that said, when I had the meeting last week, Mark was on vacation, so I joined the meeting. The first part of it, we did talk a little bit about COVID and the testing and so forth, but we didn't get really into too many details about the actual IMA because I know there's been questions and so forth that have been circled around. But we did talk about that normally after they sign the IMA, they do a scope of work and a budget. Just to reiterate, I think the board probably remembers that there's actually going to be a board set up. We'll have one voting member, which I assume will be Mark, but one voting member that will sit on that board. So normally that board writes the scope of the work and then defined a budget. But because of quite a few questions, including ours, they're going to do the scope of work now and do the defined budget for the first year so everybody can see how it is. Right now, Hudson is still in, Hudson, Holliston, and Ashland, but they're looking at making it a purchase of services through Framingham because then at least if there's vacation time for that staff, they would still have coverage. The way that the agreement is written right now, if somebody was out sick or there was vacation, there would be no coverage. We did talk about a flu clinic, how that would work under the plan. Basically Framingham just advised them they would do exactly what they're doing for us now. They're already vaccinated, our residents, so flu will not be an issue. And we could probably put more concentration into do a COVID clinic, so we can kind of concentrate on that. Just for clarification as well, because I did ask some specific questions, the job has been posted, so I know people have asked about the job description. The job was posted 2.5 months ago. So if anybody knows anybody looking for a nursing position, it's still out there. They had 3 people apply. 1 withdrew, 1 got a higher offer, and the other one was not qualified. So they're still looking for somebody full-time, benefits. So again, if anybody knows anything, to contact the city of Framingham. Looking at a couple of my notes here. I think that covers it for me for the item number 5 for the IMA and the nursing services. Does anybody have any questions for me on that? Is there? Look at Chris, you are. Oh goodness. If everybody's all set, I'll move on. Just a couple other quick things. As I think the board knows me pretty well by now, I mean, these items I put on the agenda is because I want answers, and some of them seem to be taking quite a bit of time. So I took it upon myself to get one answer, and I'm going to share this with Mark when he gets back. So last budget year, we were over in the salary line item by 10,000. This is because of non-union cost of living increases, as well as we take $5,000 annually out of our food program and move it over to cover or to offset Mark's salary because he does food inspections. So that takes care of the overage in our FY20 budget. We weren't, bottom line, we were not over, but just that line item. And we talked about it at a couple of meetings, so I wanted to make sure that I got that answer for the board. Just to let you know, the things that I put on the agenda, if anybody has anything else, I'm going to probably type up a list for Mark, because I think with everything going on, it seems to be getting overwhelming. We talk about the same thing meeting after meeting. So I'm going to do like a pending list for Mark, just so he can see some of these items that we're talking about.
So Diane, can I just back up?
Sure.
So there was an overage on our budget that Mark presented to us, and somebody went and talked to the financial director and found out. I'm not too sure if Mark said he was in contact with somebody. I used to work with the finance director, so I actually just asked her, and she wasn't contacted, but she wasn't contacted by Mark, but she said she would look into it. So she got back to me and she advised me that, bottom line, which is what matters, right?
It was not over, but explain to me how come we were over in that line item.
Could you explain to Mark when he gets back so that he knows going forward how that works? Okay.
Yeah, I'm thinking that I might see if Mark, about having a meeting with Mark and maybe Jen, just to go over some of these things. I don't know about anybody else, but on my pending list, I feel like I have a lot on my pending list. And I know when we reorganized this, we talked about a lot going on. I think sometimes some of the things get pushed down at the bottom of the list, and we just need to make sure that they stay on. So
yeah, one of those items I'm sure is coming up.
What'd you say? I didn't understand you.
One's coming up that I want to talk about.
Oh yeah, I was going to say then the next. Well, the Medical Reserve Corps, I assume that's what you're talking about.
Yep.
Again, it's been a little challenging to get a meeting set up with the Medical Reserve Corps chair, Mike Gernick, and the Medical Reserve Corps group that's housed in Framingham.
Okay.
So I'm still pursuing having a meeting. I know Ed mentioned it. I mean, we have possibly, clinics coming up in the future. We need to make sure that we know how much supplies we have, which I do expect an inventory of that. We need to really work on our recruitment. So I'm hoping that when I finally get the meeting, is that they shed some light on it. And honestly, I have some basic, like I don't know if we're supposed to annually appoint Mike Gernick as the chair. I'm not even too sure how he's appointed, or if we are supposed to do it. Like, some of the basic questions I need to ask to kind of go back to find out where we're at.
I think, you know, we really thought that we had a process down after we brought in, I forget her name, that's sort of the overseer of the medical corps.
Roberta.
And, you know, we thought we had a process in place that would simplify getting volunteers, but it kind of fell apart and for a lot of reasons. But so I think we probably have to maybe work with other towns, and I'll take it upon myself to contact Kitty Mahoney and just ask her, like, what's your process? Because I just think we have to streamline how you sign up for it, how you take that first class online, how you get your badge. I haven't gotten mine yet.
I haven't gotten my badge. That's my fault. I think what I would ask Judy, if you just hold on just a little bit, so I'm trying to get this actual virtual meeting together. And I mean, if you're welcome to join the meeting as long as we don't have 3 of us. For the exact same thing, is because we started the process. It did not seem that smoothly. We need to work it out because we collectively need to get more members, and we need to iron out some of the glitches. And I'm hoping, I mean, Mark will be back next week. I'm hoping I can pull the meeting together so when he gets back, it'll be already on his calendar.
Okay.
Yeah, I've been with the board for the past 5 years or so. We have never had any appointment done for MRC. I understand that this probably Board of Health does it, but never took any steps that I know of.
And that's a question I have to ask them. I don't know if we're supposed to have it on as an annual appointment, which I'll ask Roberta.
You'll find out. You'll find out.
Yeah.
Okay.
All right. Let's see. Then the next item on the agenda is the minutes from July 7th. Did everybody get a chance to look at them?
Yeah, there were 2 sets. There was an amended set. Just, I don't know if all of you caught that.
Yeah.
I make a motion to accept the amended set.
I'll second that.
Yeah.
Aye.
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 Hi, Chris.
Aye, Diane.
Aye, Judy.
Aye, Robot.
What'd you say, Chris?
Aye, Robot.
Well, I was gonna say you're the next item for discussion. So the next meeting would be the 18th.
Mhm.
In general, usually July and August, we only meet once. And we have been meeting on a regular schedule. If the board wants to meet without Chris, we can meet on the 18th. If not, we can meet on the 1st.
I got a feeling Triple E is going to be at our doorstep, so we better do the 18th.
Okay.
And Diane, I don't know if you can talk about this now or put it on the meeting. I know that you had the walkthrough with the Board of Selectmen. And
oh, yes, thank you.
And I'd love to hear about that.
Yeah, we can talk about it now because it was a COVID one, and I'm glad you reminded me, Ron, because I was very impressed. I know Sergeant Berman was there as well. So we actually Judy was there as well, but KG too. But just for the record, we didn't have a board meeting. But, it was eye-opening, the process that was put in front of them to make sure that our children were safe. They had us go on a school bus, like the children would, sit every other seat, which was interesting. It's been a long time since I think we've all been on a school bus. Then get off the school bus at each school and show us how they will line the children, kids of all ages, up at the different schools. They brought us through the hallways to show us the one-way hallways. Some of them they do have to split, how they're gonna mark the floors. And then we went into each classroom at the school. And it was eye-opening when they set the desks up for 3 feet and they set the desk up 6 feet apart. Some of them were shoulder to shoulder, you know, it depends on the angle of the room. But all the students have to face forward, which is very challenging for the way some of the classrooms are set up. Again, I think all I can say was very eye-opening. My understanding, and please correct me if anybody has any kids in the school, my understanding is they're making a decision to go 2 days a week in person for the school. And I'm assuming the other 3 would be virtual. I just heard that today.
Yeah.
But they had to submit 2 different plans on their protocol for reopening. So I'm assuming that's what they're going to go with the 2 days a week. Well,
How many students are they allowing on a bus? Do you know?
20, right, Ed?
15, I guess.
well, it depends, right?
No,
Depends.
so we have 77 passenger buses, so we can put 25 on a bus.
Okay.
I say that because they were saying that, there's some parents who won't send their kids to school at all, physical school. So they're saying that the numbers are all over the place on how many actual students are going to be in the classroom and how many students aren't. But there was a lot of factors that they have to deal with, and it was very eye-opening. I know we talked about having Jim Adams at our next meeting on the 18th to go over it. Chris, are you comfortable with us still doing that?
I have nothing but faith in all of you.
Okay. So if the other, is everybody comfortable with that, to see if we can?
That's fine.
Okay.
Diane, so does it work that the teachers are in every day, but the students are only going to go, one set of students is only going to go 2 days a week, and then there's going to be like a live feed so that the students at home are kind of plugged into the class? How does that work?
My understanding, Ed might be able to elaborate on the teachers, but my understanding was the separation of the just 2 days a week is for 1 day to clean. If I understood that, Ed, so they would go 2 days, there'd be a cleaning day, and then there would be the second set of students who came. I'm not sure if I'm assuming staff would be there all the time, Ed, do you know? I'm not sure about that.
I think what the plan was 4 days a week. Wednesday would be the major cleaning day.
Okay, so, yeah, I think nobody
Again,
would be there.
it's not, and it's still being negotiated, a majority of it.
Okay, yeah, okay. And when I talk to Jim also, is if he feels that, he may or may not feel comfortable coming on the 18th. If not, we'll move it, but I'll check with him to see if he thinks he'll have information then.
Kate, from Diane, you and KG and Judy went. KG, what did you think about how?
Yeah, there is problems are like, team learning may be a difficulty because they cannot put the students together in a group. That's one issue. And the other issue is that we don't know whether all the teachers want to come in either, because some of the teachers don't want to come in, they want offline. So there may be need for hiring additional teachers for the same subject, because there may be one online, one may be face-to-face. So those are the issues that they may come up. So
I don't know if it was discussed at that meeting. It probably wasn't, but I'm sure there are memorandums of agreement between the unions involved as well, because I've seen that on my end at the college. It's you have to, there's a lot of ground to cover. It's just very complicated.
it is. In fact, Suffolk University is offering transportation costs and parking facilities for teachers who don't want to take the public transportation, all of these things. But I think there are one too many issues that the superintendent has to handle. I think there are too many dots to fill in to make it right. So they may be still working on most of the items. And I think partially it's okay to get in there, but the question is, can we maintain the safe distance with younger kids? Because they cannot be controlled for all the things like the first graders or second graders. We can't do that easily. Rest of them, maybe they will listen to, the adults may not.
Right.
You watch the news, we can't control the adults.
That's possible.
Diane, sorry, one last question.
Oh, no worries.
What's the potential deadline for deciding which plan they're going to go with? And is it the Board of Selectmen or the school board or a combination of the both?
I know that Jim had said that they had to put together submit two plans, which of course the school committee would vote and support. I'm not too sure if it's up to, I'm not too sure who approves it at the state level. I'm assuming if you're submitting two, they have to pick one. I don't really know that answer. I don't know what happens after the plan.
And as Ed said, that the Charlie Baker could roll back the conditions, so everything fails out. He made the plan, and then Charlie says,
everything is subject to change with the numbers too. Yeah.
Right. So that's a big thing.
Oh.
Okay, we ready?
All right.
I was gonna say, I'm not, there we go.
Who's hungry?
Yeah, I was gonna say, Ed and I have a field trip.
Diane, as soon as we hang up, I'll get in my car and I'll pick you up.
Awesome.
Hey, what did you do? Why you don't know my address, Ed?
That would be a board meeting.
KG, I get enough calls from you.
You only, oh, not, I thought of coming there to the
Chris, you're
inspection
up.
too.
I move to adjourn.
I second.
Second. All in favor?
Aye, Chris.
Aye. 7:55. Have a good night, everyone.
Good night,
everybody.
everyone.
So what, are you
Thanks,
leaving
Paul.
now, Ed and Diane?
Yeah, I'm gonna go pick up Diane right now.
So I'm leaving now.
Okay.
I'll see you there.
Cheeseburger, Diane.
Bye-bye.
What'd you say, Ron?
Give me a cheeseburger from there.
Get you one of those eggs.
Yeah, right. Good luck.
All right,
Thank
take
you.
care.
Bye-bye.
Bye-bye.